Welcome to Everyday Nursing Knowledge Lectures, and today we will learn more about edema. Edema is swelling of tissues and it is caused by excess fluid. It can happen anywhere in the body and it is usually seen in lower extremities. It can happen in eye. If swelling around the eye, it's called periorbital edema. Macular edema is the edema of macular region. At the back of our eye, a layer of tissues are called retina, and at the center of the retina is the macular region. And if there's swelling in the macular region, it's called macular edema. It is a serious complication of diabetic retinopathy. Papal edema is the swelling of the optic nerve. Optic nerve connects eye to the brain. It can happen because of pressure in and around the brain. Swelling can also happen in bowel, can happen in muscle. If it happens in the brain, it's called cerebral edema. And if it happens in lungs, it's called pulmonary edema. Both cerebral edema and pulmonary edema are serious conditions because these both can be life-threatening and it needs immediate treatment. Swelling can happen in extremities, upper and lower, but usually seen in lower extremities, especially legs, ankles, and feet. If you apply pressure on the swollen area and it leaves a pit or indentation, it's called a pitting edema. Now let's see the causes of edema. The mild causes are prolonged immobility. If you stand or sit for a long time, or when you travel for a long time, due to gravity, water gets pulled down to the lower extremities or to the dependent area and causes mild edema. Pregnancy. During pregnancy, uterus puts pressure on the blood vessels in the lower trunk of the body, causing edema. Salty food. Sodium can retain water and salty food can cause mild edema. Now there are certain disease conditions that leads to edema. In heart failure, heart cannot pump blood effectively. As a result, there is backup of blood in the lungs, extremities causing edema. Kidney disease or damage. Kidney filters or removes excess water from the body. So if there's a kidney disease or damage, it can cause retention of water leading to edema. Another cause is cirrhosis of liver. Cirrhosis is the fibrosis or scarring of liver tissues. So when there is cirrhosis, normal blood flow through the liver is obstructed, or normal blood flow through the liver slows down. As a result, again, there is backup of blood that can lead to ascites or swelling of the lower extremities. Another reason is underactive thyroid gland or hypothyroidism. Hypothyroidism can lead to weight gain, edema, puffy face, etc. Venous insufficiency. Veins has valves which helps to promote blood to flow towards the heart. So if the vein is damaged, there is backup and pooling of blood can occur, leading to swelling. Another reason is inadequate lymphatic system. Lymphatic system helps to drain fluid from the tissues. If there is an obstruction to the lymphatic, that leads to swelling of the tissues. Another reason is severe long-term protein deficiency. The protein has oncotic pressure which helps to keep fluid in the blood vessels. So if there is inadequate or low protein, fluid leaks from the blood vessel to the capillaries, leading to edema. Now, edema can be secondary to certain medications. Example, non-steroid anti-inflammatory drugs, estrogens, thiazolidinediones, it's a diabetic medicine, calcium channel blockers, and it can secondary to some chemotherapy drugs. Now, let's see the signs and symptoms of edema. Definitely swelling. The skin is stretched and shiny over the swollen area. Increased abdominal size as you see in ascites. Difficulty moving joints. Coughing, shortness of breath and chest pain you will see in pulmonary edema. The treatment. Treatment depends upon the underlying cause. So rule out the cause and treat the cause. Mild edema resolves by its own or through lifestyle modification. Example, elevate extremities, exercise, low sodium intake, and compression stocking. Medication used to treat edema is diuretics, example Lasix, which helps to remove extra fluid from the body. If edema is secondary to the medicines or the side effect of the medicine, find an alternative medication. So today we learned about edema, and thanks for watching my video.